one thing you do in your clinic or hospital to handle child?
The baby is always crying. A 2
Yeah.
years old baby or a 18-year-old child also.
Just differentiate different type of courses in
We
pediatrics.
have a course in neonatology, endocrinology, cardiology.
The common mistakes like doctors do.
Things I would rather say which you should be aware of is like counseling the whole family about the disease of the child.
What would be the average salary of a pediatrician? Is pediatric fellowship from DMHCA is different from PG Diploma or DNB in terms of like hands-on exposure. Can parents help children to stop thumb sucking or using a feeding bottle? Like, is formula milk better or mother's milk?
According to the latest data, out of 5 babies, one baby is suffering from depression.
Hello everyone, welcome to the very first episode of Mentor Talks by DMHCA. We are starting our very first episode with someone very special, Dr. Anand Bhatia. He has been guiding young doctors in both online and offline classes and he loves teaching pediatric. And yes, finally we are going to have candid and fun chit chat about his journey and some career advice, and yes, salary too, and also most importantly some parenting tips. Hello doctor.
Hello, ma'am. Thank you so much for this beautiful opportunity. I'm really obliged. Thank you.
How are you?
I'm amazing. How about you?
I'm good too. So we are very glad to have you here. So could you please just introduce yourself to our audience?
Definitely, ma'am. My name is Dr. Anand Bhatia. I have done my MBBS and I have done my specialization in the field of pediatrics. And now I'm working as assistant professor in NDMC Medical College, New Delhi. And today we are here at a wonderful studio of DMHCA. Special thanks to you and the team, and it's wonderful.
Thank you. So first thing first, like how did you choose pediatrics? Like pediatric chose you or you chose pediatrics?
So pediatrics, or I would say child specialist, and I think this is one of the most beautiful branch. Why did I choose it? Because my seniors used to say that in every branch you can make money, but child specialist is one branch where you can make money with blessings.
Yeah, true.
Number one, and number two, very importantly, which I have experienced is that you just don't treat the child, you treat the whole family. The mother comes to you with a lot of expectations, and this is the wonderful branch, and I think that's why I chose it.
Correct. I feel you play a role of counselor also.
Ji,
Yeah.
very true.
Okay, so can you please tell us about little bit about your medical college journey? Like how was your first year and how was it different from your third year?
So yes, ma'am, I did my MBBS from Bangalore. Ambedkar Medical College is in Karnataka.
Oh, nice.
And I remember when I went to Bangalore, I'm from Delhi. So it was a little difficult because the whole family, I had to leave and I had to go to Bangalore. And being like the whole MBBS is of 5.5 years. So it was a roller coaster ride. I wouldn't say that it was very easy. There were new challenges also. And the study material for the doctors is little tough. So it was a roller coaster ride, but with all good and positive memories I had. So overall, it was a wonderful experience.
Okay. So like is there any theoretical part in one first year and then some more practical part in third year? Was it like that only?
Exactly. So in first and second year of MBBS, we have the basic subjects like anatomy, physiology, biochemistry. And coming to third year and final year subjects, we get this experience of hands-on, to the patients, where you take the case history and clinical examination of the patient. So that is how the whole MBBS journey goes.
That's great. So, like, do you remember any first day of your hospital or like when you handled your like first case of your life?
So the first day of my MBBS journey, I mean, I was only remembering my mom because she was crying and it was a tough time for her because till 18 years I was there at home in Delhi and then she had come to Bangalore to drop me. So it was difficult to leave your parents, and I remember that time only I made new friends in my first year of MBBS. They also, some had come from Dubai, some had come from Kerala. So all those people had come from different places, and then I realized that this is how you learn and have experience in life.
Yeah.
So this is what I could witness.
Yeah, but it was, I think, a great moment also because you are going forward for something very good. And like, if you could just remember, like, what was your first case, like, which you handled exactly? What was that case?
So basically, first day is our dissection table day. Actually, the doctors who are watching this show, they might understand. For first year of MBBS, we have a subject known as anatomy, and in anatomy, we have to do a dissection table. Basically, we
Okay.
have to dissect a proper human body. So that was the first day, and I'm sorry to say, I fainted on that day because it was so difficult for
Of
me,
course.
and the smell, everything. This was the first time I saw a human body like that, and I fainted. And next day, the head of the department, he called me in his room and he said, "It's okay, you are a new chap, no problem, but that is how you become doctor, so don't worry about it."
Yeah, of course. Like it was a scary for you.
Yes, yes, ma'am.
Yeah, okay. My next question would be like, what inspired you to join DMHCA as faculty?
Number one, it's a wonderful platform. Number two, why it is wonderful. The best part I like about over here is that the syllabus is not too vast. It is to the point, it is logical. And one more beautiful thing about this whole platform is that the clinical knowledge and the clinical acumen basically is being focused over here in the students. So a lot of students, they message me that we are a part of this institute, and more than the theoretical, we are learning the practical knowledge, and that is what the other centers, I think, they are missing. So this is the best thing I like.
And also DMHC provides online and offline both, so it would be, I think, a great opportunity to doctor. Like if you are busy in your studies or something, you can just simply join DMHC and you are good to go.
Very true, because a lot of interns, participate in this program, and everyone is not free when we are free. So whenever some intern is there in the night duty, day duty,
Yeah.
so having an online, coaching really helps a lot.
Yeah. So for our audience, like, could you please break down the pediatrician word in simple words?
Yes, definitely. So even my father also has a difficulty in pronouncing pediatrics.
Yeah.
So pediatrics is the name itself is so beautiful. Pedia means child, and iatrics means healer.
Oh.
The real meaning of pediatrics is child healer. You are healing a child. It's a study from 0 to 18 years of life where we watch the newborn baby to adolescent. So the simple word which I can tell you is it's known as child healer.
Okay, so being a pediatric, like what was the like your favorite moment being pediatrics?
The favorite moment, I mean, a lot of favorite moments are there, but when I finished my MBBS and MD, and when I got the degree, my parents had come to receive it. So malab, everyone was really happy about it. And 5.5 years of MBBS, 3 years of MD, being a doctor, at least 8 to 10 years of your life, you're only studying, studying, and studying. So finishing the whole degree in time itself was the best part of being a pediatrician.
Yeah, like I would like to ask one more thing. Like, what's the best part of being in your clinic or around like children and all of that? Like, how's your experience? Like, how you feel?
So I tell you one thing, we deal with a lot of newborn babies with a lot of congenital heart disease and a lot of tough cases also. So my seniors used to say that, the baby will not tell you that he has pain in the fifth finger.
Yeah,
The baby will not tell you, I have a little bit pain in the right side of my lower back. He won't tell you that.
of course.
You have to be like an angel. You have to be like that beautiful, positive person. Baby will come to you, will only cry. Doctor, mera bacha doodh nahi pi raha. Doctor, my baby is not feeding well. That's all the mother has to say you. And you being a wonderful person, you need to diagnose it. So this critical, this sensitive thing about the pediatrics, which is not there in any other branch. So this is like a challenge to me, and I love it.
Okay, so were you not like scared when you were just handling the first child or your first case?
So like we do have a lot of seniors and consultants and heads and professors during our trials and our journey. So they teach us a lot. So you get confidence by some time. So it's all okay.
Okay, so what's your advice to the doctors or students who are pursuing the same like with DMHCA?
So the students who are pursuing this course or a course associated like that, I can only tell one thing, that follow your passion. You need to follow your passion. See, everything has money. Okay, if you're don't focus about money, don't focus on becoming rich. What are you good at? You should ask yourself. No, radiology has lot of money. Skin specialist, I heard, has lot of money. Nowadays we have seen people, they are jumping and running towards the money. That sir, you being a child specialist, you look very happy. I think child specialist is a very lighter branch. No, it's not like that. I like it, so I'm happy. So the moral of the story is, don't run behind money. Follow your passion. Ask yourself, what are you good at? And once you ask yourself and then you polish yourself, then the whole journey makes
Yeah,
sense.
so if I conclude this, you just need to discover yourself first, like what you want to do, and like at what you are good with. Only then you should pursue the course.
Very true, because ma'am, I would also like to say that MBBS is a 5.5 years of course.
Yeah.
First year, second year, third year, final year, you get acclimatized to a lot of subjects, and by the end of the whole career, the student himself or herself should get an idea. कि यार, I think I'm good in surgery.
Yeah.
I think I'm good in obs gynae. So but students come and message me, sir, पैसा किसमें ज़्यादा है? Sir,
Yeah.
money. Sir, my parents want money. So I'm like, bro, what are you good at? No, that I'll think later. Tell me, money is more in what? So that's what our thought process has to be a little changed. What are you good at? Ask yourself and work towards it.
Yeah. If you could just go back in past, so like, would you still choose this passion or like something else?
Any day I would love to be a pediatrician again, because it's a good branch, and once you accept the branch, I have no regrets about it. I have done a lot of hard work behind this, so this is the best for me, I can say.
Okay, so I feel my next question would be very interesting, and I'm sure most of the people would want to know about like what would be the average salary of a pediatrician.
So this question, thousand times people have asked me. So the average salary of a pediatrician, see, you do your MBBS and your MD pediatrics, the starting salary is 1 lakh to 2 lakhs per month. But that is not the end. If you have a private practice in the evening, so basically now we need to use our brains. Basically,
Yeah.
money plays a very important role. You have one job 9 to 4, you will be earning 1 to 2 lakhs per month. In the evening, if you have a private clinic, 5 to 7 or 6 to 8 p.m. you're working every day for 1 month, 1 to 2 lakhs will come from there. Saturday and Sunday, you should work in a periphery or kind of a peripheral hospital and have OPD there. If you
Okay.
do that for 4 Saturdays and 4 Sundays, you'll get 1 to 2 lakhs per month. So the multiple sources of earning money, by the end of the whole story, how smartly you use, you come to around 8 to 10 lakhs per month. But if you use your brains with online classes, offline classes, weekend peripheries, OPD, evening your own private OPD, and morning your own 9 to 4 your basic hospital.
Okay, so
But if you don't do anything, and if you say just a 9 to 4 job I'll do and tell me how much money I'll earn, anyone will be earning just 1 to 2 lakhs per month.
oh, so basically it depends like on your work tasks.
Very true, because my seniors used to say that, I was also a little dejected when I finished my MBBS and MD. I used to hear doctor earn lakhs per month and all that. When my seniors told, smart approach plays a very important role. It's not hard work, it's smart work. How smartly I am a pediatrician. Now, this pediatrics knowledge I can use in how many ways? So it's
Yeah.
your obs gynae, you're an ophthalmologist, then how multiple ways you can earn money. And today I think there are beautiful ways: online classes, offline
Offline
classes,
classes.
OPDs. So I think that's the best answer for
But
this.
I think it will be difficult also, like after your 9 to 5 shift, yeah, you are going for your classes and your clinic. So how like you are doing this? If you could just give us a brief.
Very true. That's a very wonderful question. You yourself asked me this, that it would be difficult for you, right?
Yeah.
That's why I said follow your passion. If you follow your passion, I like podcast. I was waiting in my car for 1 hour to come to start the interview.
Yeah.
So, but we love doing podcasts and we are
Yeah.
happy about it. So, if you're happy about something, midnight, 2 o'clock also, if you call me again, I'll come again because I like it.
Like,
That's why the moral of the story is that if you like something, please do that one. Then you can breathe well.
yeah. So like if you could just differentiate different type of courses in pediatrics, so that would be great for our audience.
Definitely. So, if you want to pursue a course, small courses in pediatrics, we have a course in neonatology, we have a course in endocrinology, and we have a course in cardiology. In simple words, what an adult medicine subcategories are, pediatrics also have the same categories like cardiology, neurology, diabetology, and most importantly, which is very famous these days, is seeing the newborn babies, known as neonatology.
Okay. So like is there any specific course like if you do that particular course, so you will earn more, or like there's more scope for that particular course?
Right. So as I said, neonates are a very focus project for everyone, and being parents also say that our baby should be fine.
Yeah.
So newborn is something even a middle class fellow or a rich fellow wants to take to the best pediatrician. So fellowship in neonatology, they are really doing really well. So if you want, you can pursue in that.
Okay, so I have one personal question basically, like how do you feel confident while treating children?
So basically,
Newborn.
especially newborns, very true. Number one, basically by experience, our training has been really hard. After MBBS, I did my 3 years of MD. Then I did 3 years of senior residentship from Lady Harding Medical Colleges there in New Delhi. So one of the government prestigious institutes I have done. So by a lot of practice, you get the confidence. So even for the students also who are watching this show, after finishing your MBBS or whatever degree you are doing, do lot of work in government setups. Because if you do lot of work in government setups, the best hands-on experience you have, and then automatically, your confidence increases. I remember I was working in COVID, and 9 a.m. to 9 p.m. every day, you were knowing, right? COVID
Yeah.
doctors are the front warriors and
Yeah,
all that.
doctors and
Very true.
police
So the
also.
whole roads were empty, everything was empty. My parents were at home, my friends were calling, like my other non-medical friends, we are chilling out at home, and I'm like, no, I'm going to the hospital.
Hospital.
And I was in full PP, that whole kit, you
Yeah,
remember?
of
It was
course.
such a painful process of my life, but that only made me a doctor. So
Yeah.
that's how it is.
That's great. By the way, I would like to especially like thank you since you are here, because I think doctors and police were the one who were working and we were just chilling at home and like watching Netflix and all.
No, no, you also were doing really well. So we all are working hard.
Yeah. So my next question is like, how is pediatric fellowship from DMHCA is different from PG diploma or DNB in terms of like hands-on exposure?
So the best thing I like about over here is number one, the hands-on experience.
Okay.
We get a lot of experience going to the hospitals and doing the procedures like IV cannulation, intubation, which is something which is so important. If you get a degree, you should feel confident.
Yeah.
And the best part about this institute is that you get the confidence by talking and meeting and be in touch with the faculties. And I think that's the best way to go.
Yeah, of course. I think you'll get the chance to work with top doctors in hospitals. So I think that would be a great opportunity for all the doctors who are watching this.
Very true. And also, clinical knowledge plays a very important role. If I also want to take my child to any doctor, I want that he or she should be experienced enough.
Yeah, of course.
And then I definitely will ask you, I'm sorry, but what's your degree? I'm sorry, but where have you done your SR-ship? And then if you tell me I'm from DMHCI or prestigious institute, I'll be very happy to, show my child to you. So I think it's a win-win situation.
Yeah, which mean like you have that experience with everything. So that's why. Okay, so my next segment would be very interesting. Like we have been watching like these new parents. They have so many questions. Like our grandfather or grandmother, they used to do very simple things. Like we can say that desi nuskhas. But आजकल के जो parents हैं, they have so many questions, different questions, and even small questions or very small things. So I would like to ask those. How can parents help children to stop thumb sucking or using a feeding bottle?
Yes, so I think that's a very interesting question. Bottle feeding has been a big problem these days. As in, the mother says, "Doctor, bacha manta hi nahi hai.
Hmm.
Doctor, my baby doesn't understand anything. He starts crying. Doctor, I have to give him the bottle."
Hmm.
So, most importantly, you have to stop the bottle feeding. So, but how should I do that? We always tell the mother to encourage the breastfeeding. If you go again back to a few decades, गांव में बच्चे कैसे होते हैं? In the village, if you see, the baby comes, he's playing, he comes, he directly take the breast from the mother's breast, he takes the milk, and then he again goes and he is running and all that. That's how they have this natural immunity. But over here, the mother is over pampering the child, and everything is very oversensitized. So number one, please make your child tough and smart. Number two, thumb sucking. Yes, thumb sucking is a very dangerous thing, because if the baby is sucking the thumb again and again, his teeth will have a malformation, because the दांतों में वो space आ जाएगा. There will be spacing in the teeth. So in simple नुस्खा, we always say that have the socks or mittens the baby should have. बच्चे को आप दस्ताने पहना दे, you make the baby wear the mittens or the socks. At least he is not sucking the thumb directly, he's sucking the sock. So that is one way. Second way is divert the baby's mind.
Okay.
Tell him, I'll give you a toffee, or maybe I'll give you an ice cream, or let's just watch some Lal Tomato, which is very famous these days. So basically, if you divert the baby's mind, someday he will change.
Okay, so why babies do this? Like why?
Yes, definitely. I
What
have
they
the
get?
ma'am. That's if that's a very good question. And I remember one thing also. एक बच्चा ना मिट्टी खा रहा था. One patient of mine, he was having this mud actually, and then the mother beats him, slaps him. Why don't you understand? It's bad for you, bad for you, bad for you. And I myself asked the child, why are you eating mud? Why are you doing thumb sucking? he says, I feel very good, I feel nice. It's a self-soothing behavior. If you remember, in adults also, it's a very interesting point. Whenever we are stressed out, some people have this habit of nail biting. They always bite
Yeah.
the nail. Some people have the hand twitching. Some people make their shoulders like that. Ki, yaar, I'm
Yeah.
feeling stressed. Yaar, I'm feeling stressed. So it's a self-soothing behavior. And indirectly, if you see, it's a mind diverting thing. मैं क्या चाहता हूँ, मेरा mind divert हो stress से, I want my
True.
mind should be diverted, so little I do like this, or maybe I'll do like this. So this is like a self-soothing behavior. And most importantly, as a pediatrician, we always tell the mother that this will go after some time. ये चीज 6 महीने से 3 साल तक देखी जाती है. It is seen in 6 months to 3 years. After that, he will go. All you have to do till 3 years of life, make your baby's mind little diverted, and then everything will make sense.
Okay. So since you have been handled so many cases, like what's the one thing you do in your clinic or hospital to handle child? Like, do you have toffees, toys, or anything else?
Yes, yes. You only have beautifully answered this. I always tell to my juniors, and we have thousands of students under us. We are teaching pediatrics and this and that. I always tell, that if you want to win a baby's heart, or baby is crying and this and that, have a packet of toffees in your pocket.
They are
I in
greedy.
they are angels, greedy. Yeah, in a beautiful way they are.
Greedy angels.
Very true. Because see, the baby is always crying. A 2 years old baby or a 18-year-old child also. If you give a toffee or a small treat to the baby, he will accept you.
Yeah.
He will feel good that this fellow is my family member only.
That's why we say don't take chocolates from unknown people, because they will, of course, they will.
Yeah, it's a very positive. It's a way of just getting baby towards
Yeah.
you. So we always tell, even in our OPD setups also, I always have small toffees. Obviously not the chocolates, but
Chocolates.
something which is okay for the baby. And whenever I give them, the next week the mother comes to me and tell, doctor, मेरी बेटी कह रही थी उन्हीं अंकल को दिखाना है जिन्होंने टॉफी दी थी. So the children, the baby is mesmerized by me. She wants to only show to Dr. Anand, and that's why my OPDs are always full, because I carry toffees. It's a hidden secret, I tell
Yeah,
you.
but the other scenario would be, I feel like toffees and chocolates would not be a good thing for children. So, like, what can we do in
Exactly.
that
So that's
scenario?
what I said. Not exactly the toffees.
Uh-huh.
Maybe a packet of
Packet
fruity.
of fruit.
Maybe something which is a simple, like a milk ice cream or something like
Something
that.
like
Which
that.
like a small treat I meant, which is not bad for your
Yeah.
baby's teeth, but in the way it is good. Like a ORS packet, like a rasna, like a small
Okay.
thing. Yeah, like that. Any treat basically to the baby gets where he accepts you. And once he accepts you, because treating a child, you treat the whole family,
Yeah,
and
true.
mother has lot of worries. I remember being a pediatrician. I remember, we don't even know what our parents have done for us,
Yeah.
and we don't even, we disregard them. Even though इतना कुछ उन्होंने किया जो हमें याद भी नहीं है. If I tell you,
True.
you might not be remembering what happened at 1 year of age, how many times you got fever and diarrhea, and what all your mom have done for you. I don't remember. We don't remember. But now, being a child specialist, I meet thousands of mother, and that lady has 15 to 20 minutes of whole story to tell me. डॉक्टर मैंने ये किया, फिर ये किया, फिर ये किया, इसने कुछ नहीं खाया. देन आई डिड दिस दैट एंड दैट. मैंने मिक्सी में ग्राइंड किया, उसे अच्छे से पीसा, उसे स्मैश भी किया, उसने 1 चम्मच खाया और 2 बार पॉटी करी. सो शी हैज दिस होल 15 to 20 minute story to tell me, and I'm like, oh my god, my mother would have done I don't know
So
what
many
all
things, yeah.
and then I'm like, इतना करती है क्या मम्मी? So much they do or what? So, and every mother has a story to tell, and all she wants is, I tell you, if you want to win a patient's heart, mother wants that you should listen to her. वो चाहती है कोई सुन ले उसको. तो डॉक्टर मैंने ये किया, ये किया, ये किया, 20 minutes she'll say, and उसने सब बोल दिया, she told you everything. Now she is relaxed. That's why we say you don't treat the child, you treat the mother and the family. If the mother is treated, then evening she'll go home and tell कि नहीं, the doctor was very nice, अच्छे से सुना, he was very nice. So that's how the whole loop goes.
But I feel sometimes they do ask silly questions also, like very small questions which they don't know. Like, I would say, if the child is first for them or something, but as a doctor it would be a silly question for you, right?
1,000 people ask 1,000 silly questions, but again, the answer for this is, that's why I always say P for pediatrics, P for patience.
Yeah.
You need to have patience. My friends, my junior, they ask me, I want to be a child specialist. Should I take the seat and all that? I'm like, do you have patience? Because baby will be crying. OPD is full, and there is no AC. We work in government setups. And then you can't say, why your baby is crying? Go take your baby out. Go, don't touch me, please. वहाँ से दूर से and all that. Oh, why did he vomiting over here? Oh my God, please take him away. Like that. So that's not allowed. It's ethically not allowed. Okay, that's why I always say accept the branch, accept this. It's normal. You also would have done vomiting sometimes in a hospital. So
True.
patience is the key to
Key to,
success. It's a very old frame, and that's working really well for me.
especially I would say if you don't like cha cha pepe, then you should not like go for this
Very
one.
true,
Yeah.
ma'am. Indeed.
Okay, so since we are talking about children, so is there any child came to you for treatment and he said something funny or something dumb to you, or like when you were treating them, like he has done something weird or something? If you could just share with us.
Right. Only one thing I'm remembering right now. There was a 15-year-old girl came with fever and cough and cold. We treated her and everything. While discharging, she asked me a question: "Are you married?"
Oh,
And I was like, sadly, but yes, I'm married. So these kind of question comes here and there. So what to do?
okay. So she must have like you or something, like something else.
Yeah, because she and her mother also really liked me, that because they've always wanted the Mars who's very sophisticated.
Oh,
So that's why they're like, "Sir, are you married?"
because I think you don't look like a very doctor. That's why.
Ji, very true. Very
Yeah.
true. God has been kind. Yeah.
That's nice. So, like, what are the common mistakes like doctors do while treating children?
Common mistakes. I wouldn't say doctor do some common mistakes while treating children, but common things I would rather say which you should be aware of is like counseling the whole family about the disease of the child.
Hmm.
We get a lot of newborn babies who are 700 grams, 900 grams. Their lungs are not mature. Their heart is not fully developed. In that case, family needs a lot of emotional and mental support. They really want, the doctor to see our child very closely. So that's why counseling sessions are very long for us. We are almost like a psychiatrist or a therapist, because the mother wants to really know what is happening, and you have to
Yeah.
tell her in a non-medical ways where she understands. And little bit, if I don't connect with you as a mother and as a doctor, little bit we disconnect, you will disconnect with the treatment also.
I
You
would
will.
like to add one thing here. So basically, when I born, I was also 600 to 700 grams only. So that was
Great, great. Yeah, you're a survivor then. Really, you are a
yeah.
survivor. And so that's why like counseling plays a very important role. So I wouldn't say that doctors are mistaken, but I would rather say that what thing we should be little cautious being doctors, being a gynecologist or any other field, that counseling sessions and written consent plays a very important role, because medical legal cases are increasing. So instead of blaming here and there, let's have a clean cut business
Yeah.
where you take a proper consent and then you have a camera and everything, and we counsel the parents properly that if any positive or negative thing happens, you know everything.
Okay, since you are here, I would like to ask one like very personal question. It just came in my mind. So like whenever twins happen, so like is it normal to have one is very weak and another one is very
Yes, yes. So it's a very logical question actually. In Hindi we always say कि अगर twins हैं और मम्मी ने एक रोटी खाई है, तो देखा जाए तो आधी रोटी एक बेबी खाना चाहिए, आधी रोटी दूसरा बेबी
yeah.
खाना चाहिए. पर होता क्या है कि 80% रोटी एक बेबी खाया जाता है और 20% रोटी एक बेबी को
Ah,
मिलती है. So a lot of chances it happens that way, that 70 to 80% nourishment by mistake the one twin gets, and the other twin gets compromised. So you might
okay.
have seen when the delivery happens, one baby is a good weight baby and the other
Hmm.
baby is 1500, 1400, 1200 grams. So we do see a lot of cases like that, and that's why we suggest the mother, to have a proper hospital setup, proper admission before the delivery,
Hmm.
so that for the best care of the baby.
ओके, क्योंकि जब मैं भी पैदा हुई थी ना, तो मेरे साथ भी एक ट्विन्स था एंड ही वाज वेरी हट्टा खट्टा, और मेरा था लाइक एविंग कुछ 700 ग्राम्स, बट हुआ उल्टा, मतलब एंड में ही कुडंट सर्वाइव बट आई सर्वाइव्ड. सो लाइक व्हाट्स द थिंग?
That's what it depends, that how much organs are developed, how much the immunity is developed. So that's why this is the same question I had asked my senior, I
या.
remember in my residency. So that's only the my senior told कि एक रोटी मम्मी खाती है तो कभी
हम्म.
कभी आधी से ज्यादा रोटी एक बच्चा खा लेता है, थोड़ी रोटी दूसरे बच्चे को
हाँ, which
मिलती है.
means I was having थोड़ी रोटी. He was having
but
ज़्यादा
but but
रोटी.
I would rather say IUGR, or in simple word I say twin baby or a small babies, they are survivors, because the babies who are born less weight, no, they have this automatic steroid release in their
हाँ.
body and they are like actually survivors. So we always say that low birth weight babies, they are the survivors.
Okay, so like you, since you are treating child, but how is it important to have a bond with their parents also, because I feel you are kind of counseling their parents also, because a child don't know like what's happening with her or him, but a parents knows like what's going on there. So like what's your point on that?
So basically, that's what, you need to be very transparent with the family. Okay, even though if you're very busy, even though you're seeing 1,000 cases in a day, but one case if you mismatch, one case you could not talk to the parents properly, parents feel disheartened, and then the whole story turns, it changes. So it's simple words: have a transparent relationship with the mother. If a disease you can't treat, as a doctor sometimes we say we can treat this also, we can treat that also. No, there are level 1, level 2, level 3 multi-speciality hospitals. The facility you don't have in a hospital, you please tell the parents that you can take to dash dash hospital for a better care. So transparency is all what we need.
And also I feel you just need to console them also at every point of time, because they get scared very easily.
Very true. That's why, ma'am, I'm always saying being a doctor, patience plays a very important role. Very closely, I have seen hospitals shutting. Very closely, I have seen things breaking down in 5 seconds. So these are very sensitive things. That's why I'm very blessed that I am a doctor and I have little bit of brains where I can understand, that it's a very sensitive project. You need to have a transparency. You need to love the job also. It's not that, oh God, I'm fed up. Yaar, 5 kab bajenge, main ghar kab jaunga. No, it's not like that. You need to enjoy the job. That's it.
Okay, so now let's talk about vaccination part. I'm sure all the mothers have worried about their children vaccination. So like, what's the one thing you could just share about vaccination, like childhood vaccination?
So number one, vaccination is very important. Everyone should get it done. ये दिमाग से निकाल दीजिए कि वैक्सीनेशन जरूरी नहीं है. Lot of people come to us, यार my friend they did not get the baby vaccinated, should I get it vaccinated? यार they got 10 vaccination done, I got 3 vaccination done. So a lot of conspiracies are there. Simple answer: you have a vaccination card. Whatever your baby born in a hospital, no, they have a vaccination card. They'll give it to you. Please follow that vaccination card religiously. Number one. Number two, second mistake what the parents do, and everyone should watch this interview, they show to multiple doctors. यार मैंने उस हॉस्पिटल में दिखाया, वहां तो ये बता रहे थे, so you are my close friend, I called you also, my uncle also is a super specialties in dash and dash hospital, I'll call him also. That is here you are ruining the child. That is here you're not helping, you're actually dishelping the child. Please follow one doctor religiously. If you're not trusting the doctor, the treatment will not happen. Manifestation plays a very important role. That's why I counsel the mother very carefully. If the mother is satisfied, she will genuinely give the dawai and the baby will be satisfied. So number one, vaccination card, follow it properly. Number two, please show one doctor only religiously. And if you're not trusting the doctor, show to a second one. But now you show to the second one only religiously. That's it.
आई फील काफी मदर्स वैक्सीनेशन के लिए जाती भी नहीं होंगी, क्योंकि उनको लगता है कि उनका बच्चा रोएगा या कुछ, मतलब आई डोंट नो अबाउट इट. सो लाइक इफ यू कुड जस्ट
यस. सो जी, हमारे ना गांव में बच्चे को लकवा हो गया था. जी हमने तो वैक्सीन लगवाया नहीं. इसके ताऊजी कहते हैं कि वैक्सीन तो हमने कभी लगवाया नहीं, तुम क्यों लगवा रहे हो? तो सारे के सारे बहुत सारे ऐसे मिथ होते हैं वेयर वी सी लॉट ऑफ पीपल बिहेविंग लाइक दैट. हमारे फ्रेंड्स ने लगवाया, जी इनको पोलियो हो गया था. तो लॉट ऑफ थिंग्स. हमारे गांव में डेथ बहुत हो गई थी वैक्सीन लगाने, वहां लगवाया नहीं. कोविड को लेके यू माइट हैव सीन लॉट ऑफ इश्यूज आर देयर. कोविड वैक्सीनेशन गॉट हार्ट अटैक, दिस दैट. We are really working very hard. There are a lot of researches going on. There are a lot of journals, researches going on. So let's just keep this for the doctors, and just the advice which we give, you should follow that. Vaccination is important. Even though you are in a village, even though you're in an urban city, please get your child all the vaccinations scheduled properly.
Okay, so we should prefer like government hospital or private hospitals?
Yes, very well said. So government and private hospital, see, both are very nice. Okay, it's not that government is better, private is better. Human nature has a tendency to compare. Yeah, my friend got this 5,000 wala vaccine, you got in 500 rupees. I think yours is not a good vaccine. So government hospital and private hospital, both vaccinations are equally important and they are same only. But if vaccination is not available in the government setup, you can get your child vaccinated in a private hospital. That's all is there. Government is better or private is better? No, all are same only. If one vaccine is not available, which is there in your vaccination card, you get it from the private. That's it.
Okay, so which means it doesn't matter if you go to government hospital or private hospital, just do the vaccination.
And all is there in your brains.
Yeah.
दिमाग में प्रॉब्लम है, बच्चे में कोई प्रॉब्लम नहीं है, because human tendencies, we all want to be rich, we all want to be the best.
Yeah.
And my cousin, she got vaccinated there, hi-fi doctor.
Yeah.
Yours is okay. No, it's not like that. That hi-fi doctor was once upon a time a simple person. So you need to trust the process, trust the doctor.
Yeah.
I always tell my patient, trust. A lot of my there was a recent study going on. Every day 3 to 4 people call me, okay, every day till today. Nursing staff, my friend, my cousin, यार मेरे बच्चे को खांसी हो गई, what should I give? या उसको बुखार हो गया, what should I give? So I watch every day 3 to 4 patients free. And if you multiply this in 30 days and 1 year, doctor is having some 10 to 12 lakh of rupees, which he is donating for free. If I logically talk this thing, 3 patients in a day, if I charge 500 rupees for one patient, 1500 for 1 day, then 30 days, then 1 year. There are some lakhs of amount which a doctor, just like that, he's talking to you like that. And in the end we get to hear, oh, doctors are earning money really well. Oh my god, the patient was on ventilator, doctor earned money really well. This and that, you might be hearing all that.
True.
So I respect everyone's decision. I'm not saying anyone is bad or good. All I'm saying is trust your doctor religiously. If you are making the baby admit to one hospital, if you have signed that the baby should be intubated or whatever, ventilator or ICU care is needed, you please talk to the doctor 1000 times and trust him. Saying that later, we were not told this happened, we were not told ICU need is there, we were not told that baby was supposed to put on ventilator. I don't know who put that. Are you understand? So we all are human by the end of the day. So that's why I always say, luckily, so how to solve this issue? Luckily, all cameras are available everywhere. All multi-specialty hospitals have closed cabins for the counseling. They have proper cameras, they have proper audio, video, visual, everything, where you can't say कि हमको तो बताया नहीं. So that's the whole story.
So doctors also go with the process like from first to till the end. So like as you mentioned, you get so many calls and messages like asking so many questions to your relatives and all of that. So are you get like tired or like sometimes frustrated also?
No, I like this. It's all good. The simple thing. Once you accept the branch, no, it's all beautiful. Because there is just two ways of living life. I can get agitated. I can get frustrated. I can get, oh my God, why are you calling me? I already had 150 ka OPD today and I reach home. No, it's okay. He's also is a soul. She also is a soul who is in pain. I always tell my junior, whenever the patient comes in a hospital, I tell my juniors, this is not a Radisson Blue hotel. Mother has not come for a 5-star spa or a treatment. This is not Radisson. It's a hospital. Someone is in pain. Hospital is one place. Someone is in pain. Mother would have tried Google knowledge. Local दवाई दिया होगा. 5 दिन डॉक्टर ये दवाई दिया, ये दवाई दिया, ये दवाई दिया, आराम नहीं आया, मैं भी आपके पास आई. तो उसने 4 दवाई दे के वो आई है आपके पास. We always tell them, there's a note. Kindly remove your Google IQ outside the clinic or outside the OPD. Doctor, I gave this headache was there. Cancer तो नहीं है. Google में cancer लिखा था. Baba, every headache is not cancer. So that is what comes duty of a doctor, where don't get angry, relax, it's okay, no problem. And then talk to her, no ma'am, it's not like that. Let me run some tests. Let's see what I can do. So that's how.
So I feel Google Baba is everywhere nowadays. कुछ भी होता है तो Google ने तो ऐसे बोला है कि हमें ऐसा कुछ हो गया है तो वो चलता है. So since we were talking about vaccination, so if you could just give advice to our upcoming generation about vaccination only.
Yes, so very well said. Upcoming generation. So cervical cancer is one of the most commonest cancer you see in the girls, in females, in our moms, in wives, in mother-in-laws and sisters-in-law. So starting from 10 years to 45, 50 years of life, सर्वाइकल कैंसर के केसेस बहुत ज्यादा बढ़ रहे हैं. माई वाइफ और फैमिलीज, so this awareness of getting the vaccine for cervical cancer is very important. So all the mothers who are outside listening to our show, so I would rather say them, talk to your medicine or your doctor and ask them, doctor, when should I get my cervical cancer vaccination done? So that's important.
So I'm sure our video is watching by so many mothers. So I have few questions from mother's side only. So I would like to ask you those questions. Like, is formula milk better or mother's milk?
So definitely mother's milk is best for the baby. Formula milk is not good because number one, India is a developing country.
Yeah.
If I tell you a simple story, formula milk का जो डब्बा है वो 800 रुपए का आता है. तो 800 रुपए का डब्बा 3 दिन चलता है. The formula milk is around 800 rupees. It goes for 3 days. If you spend 800 rupees for 3 days, and if you have 1 month, if you calculate, there's some thousands of rupees. India is a developing country. In our hospital, father does not even have money for the clothes of the baby. We have rickshaw pullers, we have laborers who comes and get delivery of their wife. They don't have money to buy the cloth of the baby. How come he'll have money of 20,000 rupees per month for the dabba, then for the diaper, and for this and that, and and then blaming all on the wife. तुम्हारी वजह से बच्चे का ये हाल हो गया, just because of you this happened to my baby. Are you understanding? So again, counseling plays a very important role, and doctor's background plays a very important role कि आपके सारे पैसे बच जाएंगे अगर आप बच्चे को केवल माँ का दूध पिलाएंगे.
Okay. So what's the difference? Like, if suppose a baby is having a mother's milk and there's another kid who's having a dabbe wala milk, so what's the difference? Because again, here's my personal story. So basically, when I born, my mother passed away after 4 days only. So I was on dabbe wala doodh only, and I still remember my father told me that we used to give you that milk 2 number, 3 number.
Right.
So like, is there any difference between me and other person?
No, everyone is wonderful in their own way. It's just that if mother's milk is not available, then definitely we can go for second or third option.
Yeah.
But what if when the mother is available and you're not giving the dabbe wala doodh? And number two, mother's milk has a lot of antibiotic, lot of immunoglobulins. In simple words, they have thousands of positive things which the powder milk or the top feed, which you say, don't have. And for giving the top feed, you have to give bottle feeding. आप बनाएंगे उसको, बॉटल से पिलाएंगे, बॉटल गंदी होगी और बच्चे को डायरिया लगेगा. तो 99% of cases we have of the bottle feeding, डॉक्टर दूध नहीं आ रहा, मैं क्या करती, डॉक्टर milk is not coming. So milk is not coming is not the problem, psychological is the problem. कि after 4-5 months the mother start thinking अभी तो मेरा दूध नहीं आएगा, अभी तो डब्बे वाला चालू करना पड़ेगा. But if you come to a doctor, we have a proper MCQ question for that. A mother produces maximum amount of milk at 5 to 6 months of life, but you need to tell the mother. If I tell you, yeah, milk will not come, ma'am, you should shift to something else, then you will say, yeah, I have to join job also, hai na? Don't give breast milk, give something else. If I counsel you that way, your mind will start manifesting, yeah, doctor was saying my feed will not come. But if I tell you this is the maximum time your feed will come, thoda sa aur mehnat, little bit more effort is required, then you will say, no, I'll try. So it's all counseling process.
Okay, so since we are talking about babies, so whenever I hear a word baby, the first word in my mind comes is sleep. So like, if a baby sleeps a lot, so like, is there any problem or something, or like it's fine?
I think it's perfectly fine, and that's a good question to ask, because mothers don't know a baby should sleep for how many hours. A baby can sleep continuously for 16 to 18 hours, okay, a newborn baby. But every 2 to 3 hourly, you have to make the baby wake up and feed him. हम हमेशा कहते हैं कि बच्चा माँ के पेट से सीख के नहीं आता, आप तो सिखाते हो, right? You make the baby learn. He does not know everything, so he can sleep continuously for 10 hours also, but no, he might land up into hypoglycemia, So every 3 hourly, put an alarm. After 3 hours, make the baby quietly wake up, and just latch him, attach him, and he will feed. Because the baby's tummy, it'll get empty in 2 to 3 hours. बिल्कुल नींबू के साइज जितना बच्चे का टमी होता है, तो जितना नींबू में आता है दूध उतना ही आता है. So that's why after 3 hours the milk gets empty and he'll start getting hungry. You latch him. So that's what.
That's a very brand new information for me. Okay, so my next question would be like, antibiotics are necessary, or like, is it important, or it's fine if you don't give or something?
Very true. So this is for all the mothers actually. The Google IQ knowledge, for every cough and cold, you give this antibiotic, that antibiotic. Baby start getting diarrhea, chalo usko, you'll give some another antibiotic. Please don't give antibiotics, number one. Number two, why? Because antibiotic will stop that problem for the time being, but the immunity will not develop. After 1 month, if the baby has same diarrhea, that first antibiotic will not work. देन डॉक्टर आई हैव टू गिव नाउ सेकंड हैवी एंटीबायोटिक बिकॉज इतने छोटे टाइम पे तुमने वो एंटीबायोटिक पिला दिया, एक साल बाद अगर सेम खांसी जुकाम होगा, नाउ यू नीड अ बिगर एंटीबायोटिक। सो बच्चे को एंटीबायोटिक से इतना ज्यादा एक्सपोज ना करें। if you give me antibiotic at 5 years of life, तो अगर it depends, it depends, if you gave me at newborn period only, then 5 साल पे तो मुझे बहुत heavy दवाई का जरूरत पड़ेगा। So number one, say no to antibiotics. Number two, again, go to your doctor na, talk to your doctor. If you have diarrhea with blood, if you have diarrhea with fever and infections, then antibiotic is required. So doctor is the best just to decide, not you, not the Google, not your India has this problem. And I went to the pharmacy, he only gave for cough and cold and this and that. Thoda aap ye wala le lo, 5 दिन बढ़िया मजा आ जाएगा. So that's what. So stop doing that. Go to doctor, talk to him. If he feels, he will say tell you antibiotic.
Okay, so now I have very fun and serious question. Like nowadays, I see children wants phone or TV while having their food. So like, will it affect to their eyes or?
Very true. So, ma'am, screen time जो है plays a very important role these days. Screen time has so many negative effects. According to the latest data, out of 5, babies, 1 baby is suffering from depression. Out of 5 adolescent, if I talk about, out of 5, 1 is suffering from depression. That means in every family, there is one person who is depressed. Okay, this is the latest data if I talk about. Now, why the depression cases are going? Why are we getting agitated so fast? Sir, I'm not able to concentrate well in my studies. Lot of students come to us. This is because of the screen time. There is something known as popcorn memory.
Okay.
Instagram, tuck, 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 we do that. 30 seconds, I don't feel good. Khadak, I, swipe it. So, before we used to have proper books to study. Now we have ebooks, PDF, short files. Technology, I don't know who is using whom. Are we using the technology or technology is using us? Just because of this popcorn memory, 40 seconds, I didn't like it, I swiped it. So the children are lacking focus power. They're not able to focus. So that is why they are getting autism. Autism and childhood depression are the latest hot topics of today's era. Because I have so many options in my life, I'm getting too distracted. Nowadays, ma'am, I tell you, there's a lot of fashion of multitasking. And multitasking, frankly, is the worst thing to do. I'm traveling, I've listened to music also, I'll update my WhatsApp status also, call my friend also, and do this and that also. That is the worst thing you can do to yourself, frankly speaking. You need to do one thing at a time. Childhood is eating also, the baby is eating also, Instagram also, mother is saying how was your school, and TV lal tamatar is going on. Too many distractions, human brain cannot take it. And the mother will say kya karun doctor, manta hi nahi hai,
like
manta
how
hi
to
nahi hai.
convince them?
How to convince them? Very good question. How to convince them? First, convince the family. They should know that this is wrong. Doctor tab kya kare, what else should we do? In the book it is written, 15 minutes of undivided attention. A father and a mother every day in the evening to the child, even though it's a 5-year or 20-year-old, 15 minutes of undivided attention. Mother is cooking, हाँ school कैसा था, अच्छा ये हुआ, वो हुआ. No, you should sit here and talk to the child. Child is getting distracted. Okay, let's go for ice cream. Let's go for ice cream. So once you walk for an ice cream and you don't take your mobile with you, now we are talking. So that's why I always tell, go to the doctor na. This thing will not be written somewhere. You need to talk to the pediatrician. Doctor, my child, 10-year-old, 15-year-old, 18-year-old, depression cases are so high, and we all are suffering from multitasking issues. We feel that we are doing multitasking. हम कुछ तोप कर रहे हैं, हम कुछ नहीं कर रहे, हम अपने brain cells को बहुत जल्दी damage कर रहे हैं. If you realize, ma'am, our brain is getting tired very fast. हमारा दिमाग बहुत जल्दी थक रहा है. Because by the evening your whole battery gets so drenched because you want to win the competition, and if you're like that, your child will copy you. My mom is working so hard, she's multitasker, yaar, I have to be a multitasker. No. So बच्चे parents को copy करते हैं. So आप ऐसा ना करें तो बच्चा भी ऐसा नहीं करेगा.
Which means first of all you need to have that kind of bonding with your child where you'll be speaking to him or like asking what's
Very true.
about his
Yeah, like how was your day and how was your schedule, basically. 15 minutes of undivided attention, that's it.
Okay, so my last question would be like very interesting, like when did you first get the idea of becoming doctor?
I remember, like, in my 10th class, we were supposed to choose medical, non-medical, and commerce. In my
Okay.
time, it was like that: medical, physics, chemistry, bio, physics, chemistry, maths, or commerce. So I had called my dad and I told him that I'm getting an option to choose medical, but my sister was saying that don't choose medical; it's very tough. Your
Okay.
brain is not that great. Don't choose medical. You choose non-medical. And I called my dad and I told my dad, मुझे ना लोगों की सेवा करनी है. I don't know, some stupid idea I had. I don't know what. I want to help babies. I want to help, normal people. My dad is like, you want to help? No, take medical. No, take medical.
Mhm.
And my sister was like, don't take it. It's too heavy. It's too heavy. And then I just took it medical. And most importantly in life, what I have learned is accept once you take something. Accept the
Yeah.
branch. There's a very beautiful quote. They say the problem is not the change. The problem is showing resistance to the change. Problem is not the
Not.
change. Problem is showing resistance to the change. I have not accepted the branch. So once I accept, बाबा जो भी है अब यही है,
Hmm.
इसमें हम अच्छा कैसे कर सकते हैं? How can I be more beautiful and graceful in this? That is the whole
Yeah.
story.
So basically, you have stick to your decision.
Exactly. Acceptance is the key.
हाँ.
Accept it and then start finding the positiveness in it. फिर then your mind will say, नहीं नहीं ये तो बुरा है ना, वो तो बुरा है ना, अरे दुनिया तो बुरी है ना, जो है उसमें अव्वल करें. That's how the story
Okay,
is.
so basically, when I was in school, I was also used to think about this, like I will become a doctor, but my marks couldn't support me, so here I am.
It happens, it happens. And one more thing I want to say, ma'am, that we should share to all the young generation, and even to adults also. We are all focusing on the financial pillar.
Yeah.
सबको अमीर बनना है, and all.
True.
And secondly, we are focusing on the educational pillar.
Education.
बच्चों को हम कहते हैं अच्छा पढ़ेंगे तो अच्छा पैसा आएगा.
Hmm.
So I agree, educational pillar and financial pillar are so important. But what about the mental pillar?
Yeah.
What about the spiritual pillar? वंस लाइन किसी बच्चे को हम कह दें, बच्चा खुद आके बताता है हमको, वन लाइन शी सेड एंड शी वॉक्ड अवे, होल डे आई एम थिंकिंग अबाउट इट, थिंकिंग अबाउट इट, थिंकिंग अबाउट इट. Babies mental power is going very less because of the very high competition. No, children are getting very stressed out.
Stress, yeah.
They are going into depression, and same story is happening with the adults.
Adults.
We all are want to look good, physical pillar, educational pillar, paisa, financial pillar. What about the mental pillar? कि यार whatever is there, I'm happy. No, it's fine. And then if you are like a happy soul, your child will copy you. Every mother asking this question, डॉक्टर बच्चे को कैसे मनाएं, बच्चे को कैसे मनाएं? मैं कहा पहले आप तो मान जाओ, फिर बच्चा बनेगा.
I think there's some word called post depression also for mothers, like why it happened.
Yeah, because after the pregnancy, it's a very post depression disorder is very common in pregnancies. The mother who has just delivered a baby. So it's very common. Why? Because suddenly she gained up 12-15 kg and she got a cesarean, and she used to wear this beautiful clothes. Now she has a very
Yeah.
flabby tummy, and she
With
has
stretch
to,
marks.
it's like a second birth,
Yeah.
with stretch marks and everything. I agree with you. And she have to really work hard 6 months to 1 year, get yoga, get pilate, all the physical workouts, so to come back in the same shape.
Yeah.
Because then the mother feels my figure, my whole body has become saggy, I don't look that beautiful I used to look. Because again, that mirror also is very important. So that's why post pregnancy they start getting stressed out, because it's like a second birth. Are you understanding? So because you get a vagina, you have this baby coming from vagina, you get the episiotomy, sutures, so all these painful procedure is like a roller coaster ride.
Yeah. Also, I feel families attention also get distracted.
That
and
is why
diverted.
husband and wife plays a very important role. They have to support each other.
Yeah.
The husband is the only pillar she expects. So even though she is not looking good or whatever it is, you have to tell your wife that you are the most beautiful person I have ever met, and she needs that mental support. So
Yeah.
that's how the whole story is.
Okay, so that was it for today's episode. Thank you so much for joining us. It was a very great session with you. So huge thanks to all the listeners watching us today. Don't forget to follow DMHCA on Instagram and YouTube. Catch you on the next episode.